everybody. This is Dr. Kyle with ICE, bringing you your next Ask the Doc segment. So we have a question from Pam today, where she asked, what can I do to better manage my chronic neck pain? So that is a pretty broad, encompassing question, but I kind of had a good angle that we could take on it for today that'll brush you up on some of your neck anatomy, but also help you manage maybe some of the neck issues you might be having if you're watching this video. Come follow me. Go back into a treatment room here. And we'll brush up on our anatomy. Okay, so a special thing to consider when we're talking about our neck and our shoulder is that we have two real big, strong muscles up in this region. One is called our trapezius muscle. Many of us call that a trap. And we have an upper part, a middle part, and a lower part. For these purposes, we're talking primarily about the upper part because of how that influences the neck. But another one that people forget about is what's called our SCM, sternocleidomastoid. And if you see it on me, when I turn my neck, you can usually see it pop out. So it's primarily responsible for that turning action and creates some stability in our neck. But there's an important relationship between those two muscles in that they're innervated by a special nerve that comes directly off of our brain called our spinal accessory nerve. So it's important to keep in mind when we're managing chronic neck pain, and most of us can make the point that, oh, these muscles, they're always tight. I get my massage therapist to rub them out. They just keep coming back. Very often, when we just focus where we have the pain, we neglect to focus where there could be some other relationship. So what I'm primarily encouraging for those of you watching, if you catch yourself being chronically tight here, you have pain here, you have knots here all the time, don't forget about that special muscle up here, that SCM, because your brain controls those two muscles in unison. So you can't address one and not the other. So if you're seeing a massage therapist, a chiropractor, or even just talking to your doctor, make sure that you're addressing the health and the anatomy of this particular muscle as well as this one. And that might help you get a long ways as far as getting to the deeper root of how you can address your neck pain. So just a quick little brush up on neck anatomy, but if you guys have any further questions of how we might be able to help with that or give you further direction addressing your neck pain, don't hesitate to ask. My name is Dr. Kyle with ICE. Thanks for watching.